Hello, my friend. Welcome to Doctor Health Hub, where every episode begins with a doctor's tip you can trust. Today's topic is sensitive but very important: sexually transmitted diseases, or STDs. By the end, you'll know what they are, how they spread, the symptoms, how doctors diagnose and treat them, and most importantly, how to prevent them. Doctor, let's start simple. What are STDs?
STDs are infections passed from one person to another, usually through sexual contact. That means vaginal sex, anal sex, or oral sex. Some can also spread through blood, through shared needles, or from a mother to a baby during birth. And every year, millions of new cases are reported worldwide. Some are mild and treatable, but others, if ignored, can cause long-term damage: infertility, organ problems, even certain cancers.
So they're not just uncomfortable, they can change a person's life.
Exactly. That's why awareness is so important.
There are so many names. Could you walk us through the most common ones step by step?
Of course, let's go slowly. Chlamydia, a common bacterial infection, often silent at first. Gonorrhea, another bacterial infection. It can affect the genitals, the throat, or the rectum. Syphilis, dangerous if untreated. Over time, it can harm the brain, heart, and nerves. HIV, a virus that attacks the immune system. Without treatment, it leads to AIDS. Herpes causes painful sores or blisters. Trichomoniasis, a parasite infection, often with itching or unusual discharge.
That was clear and simple. Now, how do people actually catch them?
The biggest risk is unprotected sex. Other risks include having multiple partners, having a partner with an STD, sharing needles, having a weak immune system, or not getting tested regularly.
So the risk goes up when safety goes down.
Exactly.
If someone does get an STD, what might they notice?
That's tricky. Many STDs start with no symptoms, but when they do appear, they may include pain when urinating, unusual discharge, sores or blisters, warts, pelvic pain, rashes, fever, or swollen glands. The warning signs to never ignore are persistent sores, severe pelvic pain, or any new symptom after risky contact.
That sounds worrying. How do doctors confirm it?
Through exams and lab tests. We may use blood tests, urine tests, or swabs. The CDC recommends routine screening, especially for young adults and pregnant women. Early detection saves lives.
Now for the hopeful part. Can STDs be treated?
Yes, but treatment depends on the infection. Bacterial STDs like chlamydia, gonorrhea, and syphilis are cured with antibiotics. Viral STDs like HIV, herpes, and HPV can't be cured, but medicines control them and reduce transmission. Parasitic STDs like trichomoniasis are treated with prescription medicine, but never self-medicate. The wrong drug can create resistance. Always see a doctor.
Prevention must be the golden rule then.
Absolutely. Prevention is better than cure. Use condoms consistently and correctly. Get tested regularly, even if you feel fine. Limit the number of partners. Get vaccinated. HPV and hepatitis B vaccines are lifesavers. Never share needles. And pregnant women should always be tested early.
So many myths confuse people. Can we bust a few?
Gladly. Myth: you can tell if someone has an STD by looking. Fact: many show no signs. Only testing works. Myth: condoms protect against everything. Fact: they reduce risk, but not for all infections like herpes or HPV. Myth: only careless people get STDs. Fact: anyone who is sexually active can be at risk.
That breaks a lot of stigma.
Yes, education removes fear and shame.
One last question, doctor. If someone feels healthy, should they still get tested?
Yes, most STDs are silent early on. Testing prevents infertility, prevents cancer, and protects others. It's private, affordable, and life-saving.
That's clear and powerful. Thank you, doctor. And thank you, my friend, for joining us today on Dr. Health Hub. Don't forget to like, share, and subscribe for more trusted health education.
And remember, your health is your wealth. Better health starts here. Stay tuned for the next doctor tip you can trust.